Hi, this is going to be the lecture number 3 about the cardiac axis, and I'm Dr. Ihtisham. What's the cardiac axis actually? So the cardiac axis is actually the average direction of the electrical current through the heart during the depolarization. Okay, so a normal cardiac axis is somewhere around minus 30 to plus 90, which is um, directed downward and to the left. Also, there are a couple of methods to detect the cardiac axis. So the first one is a quadrant method where we look at the lead 1 and the AVF. The other one is the 3 lead analysis where we see at the 1, 2 and lead AVF, and another one then that's isoelectric lead analysis. Here we are going to discuss a very simple method of discussing and determining the cardiac axis, that is the cardiac axis by the thumb rule method. Okay, so what you need to do over here is that you need to look at the lead 1 and lead AVF. So lead 1, take an example and suppose that you are holding the lead 1 in your left hand and you are holding the lead AVF in your right hand with both the thumbs in pointing in the upward direction. Okay, so lead 1 in the left hand, lead AVF in the right hand, okay, with the thumbs up. Now you need to turn your thumb up or down according to the predominance of the QRS complex in lead 1 or AVF. So your left hand was representing the lead 1, okay, with the thumb up. Now if the QRS is predominantly up, okay, the thumb's gonna be up. Okay, if the QRS is predominantly down, the thumb is gonna go down. Okay, this is the basic rule in this thing. Okay, this is the method. So you need to point your thumb actually in the direction of the QRS complex. If it's predominantly positive, that's going to be up, and if it's predominantly negative, that's going to be down. And you will interpret your results based on which thumb of yours is up. Okay, take an example over here. Okay, that your left hand, that's the lead 1. Here the QRS complex is up, so for example. Okay, and in the lead AVF, which is in the right hand, the thumb is down, like over here. So you need to interpret the results depending upon which thumb is up. So that's going to be the left axis deviation. This means that if the QRS is predominantly up in the lead 1 and predominantly down in the lead AVF, that's going to be the left axis deviation. Now see over here that this was your lead 1, that's in your left hand. So if the QRS is down here, but in the AVF the QRS is up, so that's the AVF is right, so that's going to be the right axis deviation. Again, so if both the thumbs are up, both are predominantly positive, okay, 1 and AVF, that will be normal axis deviation. If AVF is up, okay, and the if the of lead 1 is up and the AVF is down, that's going to be the left axis deviation, and the right axis deviation the vice versa. There is another condition, okay, another thing, that if both the QRS complexes are down in both the 1 and the AVF, that is called the extreme axis deviation. Let's discuss it on a real strip of the ECG. So if you look at this strip of the ECG, so lead 1 was in your left hand first of all, and lead AVF is in your right hand. Now the QRS is predominantly up in both, so that will be the normal axis. Now if you look at this ECG, so the one, okay, the lead 1 which is in your left hand, assume here the thumb is up, okay, and in the AVF which is in your right hand, so the thumb is down. So how you gonna, the QRS is down, so the thumb is down, so how you gonna interpret the result? According to the thumb which is up, so that's gonna be the left axis deviation over here. Let's now discuss a little bit causes of the right axis and the left axis deviation. So here we can see different causes of the right axis deviation, that is right ventricular hypertrophy, right bundle branch block, posterior hemiblock, left posterior hemiblock, emphysema, cord pulmonale, or Fallot's tetralogy. And the left axis deviation, and contrary to right ventricular hypertrophy, there's left ventricular hypertrophy. As compared to right, that's left bundle branch block, left anterior block, WPW, and hypertrophic cardiomyopathy. The extreme axis deviation that is seen in when both the QRS in the lead 1 and AVF are down, that is seen in severe right ventricular hypertrophy. So that concludes our third lecture on axis.